And welcome back. As we continue to celebrate and recognize Hispanic Heritage Month, it's also time to take a look at the health challenges that's been faced by these communities. The inequities are striking, including in New York City, and many organizations are looking to better meet the needs of this particular community. And our next guest is here to talk in depth about the underutilization of hospice services right within the Latino community. Joining us to share more details is the hospice liaison at VNS Health, RN Clarissa Santos, and we thank you so much for being with us, Clarissa, and sharing.
Thank you for having me, Darren.
Yes, well, hospice is a very delicate conversation to have with just in general. And it seems as though when you come to communities of color, and particularly in the Latino community, hospice isn't also well received. So, from your perspective, talk to me about what you're seeing with Latinos, Latinas, when it comes to hospice.
It's a good question. First of all, despite the fact that most folks have Medicare, Medicaid, and hospice, is can be covered by either one, we don't utilize hospice, and I find several things. The very first one being the language barrier. A lot of times, Hispanics, English is not their first language. When they're going to routine doctor's appointments, it's much harder when families don't really understand a person's diagnoses or the options they have at the time. I remember working once with a patient who was a lady who was being taken care of by her adult children. She didn't even know their mother had cancer. Like the doctors, the social workers had never explained, so they didn't really know what options. They just knew that their mom was very ill and was going to probably pass very soon, and they didn't really understand their options. So it's very important for, for this community to have someone, first of all, who can speak their language and who can explain to them, in a way that they would understand,
Yeah.
what is going on, what are your options. And among Hispanics in general, we also have, the idea of very family oriented. So they don't want to hear about a loved one being in a hospital. They want to know, what can we do? So that's a beautiful thing about a home hospice in particular, that we're able to bring these people who are terminally ill home and they can be taken care of by their families in the comfort of their home.
You kind of touched on what I wanted to talk about because when we talk about families, they're stuck with the choice sometimes of having to care for their loved one and doing it all by themselves. And when it comes to hospice, as you said, that can sometimes be rejected, right? And it's rejected because I want my loved one with me, or we just don't feel comfortable with the healthcare system, which is very prevalent in communities of color. So, how do you navigate that situation for families, particularly in the Latino community, to give them that assurance of the services that you provide, and at the same time, letting them know everything's going to be as best as can be?
Yeah, see, that's why I value my role very carefully. A lot of times, I'm usually the first person who can speak to them in their language, in Spanish, and explain to them what is going on and what are their options. And for the most part, once I explain to them the services we're able to offer, we have not just a nurse that comes into the home to explain the care that the patient needs. We have social workers who can help them navigate the often difficult, conversation in terms of final arrangements. We have a spiritual care counselor, which can help, especially in a family who's very religious. Let's say we have a Catholic family who's inquiring about, anointing of the sick, or, someone that comes see. Our spiritual care counselor can connect with their local priest or local a priest, someone who can come give the patient at home their services and what they're looking for, and also to still give them a sense of still identity. A lot of times Latinos, whether it be the caregivers, the families, they find themselves lost. They feel loss of identity because prior to the illness, they were very independent. We know among the Hispanic community, we have, many, many stories of women who have raised 6 and 7 children on their own with very family support. These kids came through. And we also have the caregivers. We have, especially in our community, a lot of women who find themselves kind of in the middle. They're raising their children, but they're also finding themselves to caring for their ailing parents. So it's very important that we explain to them that we do have services, we have support. Hospice is not just for the patient, but it's for the whole family. We take the family oriented beliefs of the Latino community very seriously. We want to make sure they know that this is for the whole for the whole family. It's for the whole village, not just for the patient. We offer services for the caregivers. If they feel that they're not comfortable with something, our nurse can help them address issues with whatever needs the patient needs, whether it's wound care, whether it's oxygen, whether the patient has an IV. Our nurses can help educate them on that. And like I said, once again, we have our spiritual care counselors and our social workers, which are also able to help them with any questions they have outside of the patient's medical needs.
Right.
Need to know about funeral services, spiritual care, very important. There's a lot of not all, but most of the community is Catholic, Christian of some sort, very close to their church. We can provide them linkage with their pastors, their priests, so that they feel that they're always supported. Very important.
So when we talk about concerns, obviously you said sometimes you're the first person, right, that has the opportunity to talk to them. And there are a lot of fears, first of all, because we understand that with hospice, there is going to be this transition from life to death. And sometimes that's just uncomfortable all by itself. But then to know that you're entrusting the care of your loved one to someone else, that could be another burden to bear as well. When you're talking to families, what are some of the common concerns that we're hearing amongst the Latino community with regards to this? Because we know that there's some great benefits in hospice, but if we don't debunk some of these myths and some stereotypes, we'll still continue to have to go through some of these doors.
Yeah, that's true. A very big barrier. There is still, even with the education, there's still a lot of folks, unfortunately, who equate hospice with hospital or death. They feel that as soon as they hear the word hospice, it means my loved one is dying any moment now. What part of what I do when I speak to the family, I explain to them, this does not mean that your loved one is going to pass away tomorrow, next week. The doctors explain that your loved one, your mother, your father, your grandmother, has a terminal illness, which we expect, give or take a few weeks, about 6 months of life expectancy. We have found, though, in recent studies that people who go on hospice care and receive the services we offer often outlive the 6 month expectancy. And they're also much more comfortable at home. The idea of hospice is to work with the family to assist them in any way possible. If they need education about caring for their loved ones, our nurses can assist them with that. Because at times, when patients are in hospitals and they're returned home, sometimes the hospitals aren't giving folks, or they don't feel they've been trained well enough to feel comfortable with caring for their loved one at home. So that's where our nurses come in to provide support, to provide education. We have a 24-hour hospice hotline. If the caregivers have any questions, if they see a change in status in their loved one, they can call us at any time. We have nurses available 24/7. We can help them find out, is this something that we can address in the home? Is there medication that because all our patients in home, they receive what we call a comfort pack, which has several medications which they may or may not use throughout the time that they're under our service. So at times it could be something that we can easily tell our loved one, listen, this medication you have in the refrigerator, take it out. You see this? And the nurse will guide them, give them this dosage, give them a few minutes. If this doesn't work, let's do this. Or the nurse can also tell them, well, it seems that this might be something we need to address in the hospital. We will arrange paramedicine. We always tell them not to call 911 unless we cannot help them. But a lot of times we tell them we can activate our own paramedicine services, which can determine if a patient needs to be taken to the hospital to stabilize them and then bring them home.
Yeah.
The idea of hospice is to have them at home and try to manage as much as we can in the home, supporting the family, not just the patient, the family in every way possible. On the medical end, on the spiritual end, on the psychological end, we know that this is not just a patient, but it's the whole family that we're taking care of. It's not just this ailing mother, but it's
It's
her
a
children, her
it's a whole
grandchildren,
family.
her
Yeah.
spouse. It's a whole family, and
Yeah.
that's what we embrace. We're not a hospital. We're a hospice team, and as a team, we're looking to address the needs of the entire family, the entire
Yeah.
village, as I like to call it.
Well, Clarissa, I want to thank you so much for sharing with us. I think that it's very important for people to know that there are people such as yourself and also the organization that's out there, VNS Health, designed to really help people in the most tender of times. And thank you for the service that you're providing to let people know what's available through hospice and the work that you do, especially for those who are in their final stages sometimes. Thank you so much, Clarissa.
Thank you so much, and
All
everyone,
right.
and a happy Hispanic month, everyone. And if you have any questions, you wish to learn a little more about VNS, we have services you can
I'm
call
getting
our
ready.
referral
No, don't take
system.
my line. I gotta give him. I'm giving the information right now. So hold on one second.
All right,
All
thank
right.
you.
I don't want you to take all my lines. I gotta take one more. So let me take this line and tell you. If you want more information, you can visit the website at vnshealth.org, and then also you can call them at 1-800-675-0391. Don't go anywhere. We'll be back with more open coming up right after this.